Good morning. My name is John, and today we'll be reading ObamaCare's victims are very real, so stop ignoring them. This editorial appeared in Investor's Business Daily, posted on July 25, 2017. Health reform. For months, Obamacare defenders have dominated the debate by trotting out people who would supposedly be harmed by the GOP replacement plan. President Trump turned the tables on Monday by highlighting the very real pain Obamacare is causing millions of middle-class families. During his remarks, which came on the eve of a make-or-break Senate vote, in which he challenged the Senate to live up to 7 years' worth of promises to repeal and replace Obamacare, Trump spent much of his time showcasing victims of Obamacare. Democrats promised Melissa Asserson that her son's pre-existing conditions would be covered, Trump said. The Assersons quickly learned that Obamacare's promises of covering for pre-existing conditions was meaningless. For the doctors you need to care for, you are on your plan. On the day with Trump, found their premiums skyrocketing, their choice of plans reduced to one and possibly none next year, or were forced to repeatedly switch plans as insurers dropped out of the Obamacare exchange. Democrats, he said, want to forget about the countless Americans they have hurt, and the many they are continuing to hurt every day by refusing to help us replace Obamacare. This is exactly the tactic Democrats use to sell their policies, usually to a credulous media. It's about time Republicans learn to play this game. Are Trump's examples exaggerations? Exceptions to the rule? Hardly. Insurance defections have forced families to repeatedly switch companies, which often means finding new doctors. Plans offered in the Obamacare exchanges are almost entirely HMO-style plans with limited provider networks that provide zero coverage if you go out of network. Those dumped into Medicaid find that few doctors are willing to see them because of its low premium rates. Meanwhile, millions of families are finding that Affordable Care Act is a cruel joke. Backers routinely say that massive premium increases are no big deal since 83% of those enrolling in the Obamacare exchanges get generous subsidies. But 43% of the entire individual market don't get any subsidies because their incomes are too high. That includes individuals who make more than around $47,000 a year. These people face the full brunt of the double-digit premium hikes that have become routine since the law took effect. For a family of four, the annual premium is more than $12,000 for a silver plan with a deductible of more than $7,000. The real-world impact of these huge cost increases is clear from the data. An analysis by Mark Farrar and Associates found that between 2016 and 17, the number of people buying coverage outside the Obamacare exchanges who aren't eligible for subsidies plunged by 29%, while enrollment inside the exchanges dropped by only 4%. Obamacare isn't even that great a deal for those eligible for subsidies, since only 40% of those eligible for subsidized coverage have enrolled. In what other business or government program would such a dismal acceptance by those it was targeted to serve be considered a success? Asked industry analyst Robert Lazowski. Yet these Obamacare losers have been ignored by the mainstream press, by Democrats, and until recently by Republicans. If the public were to hear more about Obamacare's very real and troubling downside, they'd be far less eager to keep it in place. All Republicans have to do is explain that the GOP plan is designed to help those who have costly medical conditions and can't get insurance, without forcing a Hobson's choice on millions of middle-class American families to either drain their bank accounts for lousy coverage or to go without insurance entirely. Trump seems to get this now. Will Republicans in the Senate? This video is a production of the School of the White Crane. My name is John Brooker, and you can reach me through commentary on this video or through my email listed here. Please share this video with family and friends and on social media. May God richly bless you.